B complex vitamins. So first and foremost, vitamin B1, also called as thiamine. So functions of thiamine, they are required for the release of energy from carbohydrates. Okay, they enter your Krebs cycle, TCA cycle and all. That's a biochemistry aspect of it. But just remember it. There is a cycle called Krebs cycle, TCA cycle, through which you get energy. The carbohydrates are metabolized and it gives out energy. And thiamine is a very essential part of it, part of that particular cycle. Okay, it is necessary for appetite to keep you feeling from hungry, for good health, needed for normal functioning of your nervous system. Most of the, you will see this coming up and again and again about the nervous system. Okay, vitamin B complex and its essentiality in nervous health, it will come again and again for various other vitamins. So deficiency of thiamine will lead to fatigue. It's a silent symptom, okay? Fatigue, depression, irritability, these are signs and symptoms. The exact name of the disease, which is caused because of the deficiency of thiamine, is beriberi. I hope we all have heard about beriberi. Okay, there are different types of beriberi, infantile and wet beriberi. We'll come to that later. So this is a disease of the nervous system, beriberi. It is common in countries where polished rice means your white rice. Okay, white rice is the staple food. In such countries, beriberi is a very common condition, because when you remove the husk of the this rice, and the fiber are part of the outer covering of the rice, when it is removed, most of the vitamin B complex is gone, and then you wash the rice before you cook it at least 3 times and all. You wash it so that the starch extra, that sticky starch, is removed. Through that washing also you lose vitamin B. On top of it, when you cook the rice and when you remove that excess water, you throw away that starch water. When you don't boil the rice properly, and like when the rice is cooked and when you cook it in a lot of water and you remove that drain of that excess water, in that form also you lose a lot of vitamin B. Okay, so this is the reason why people who live in such countries like in China, Japan, Korea, Philippines, and all, where polished rice is the main staple food. Okay, there you see a lot of beriberi cases. So beriberi occurs where main diet is polished rice or white rice. There are two types of beriberi: infantile beriberi and adult beriberi, or we call it as wet beriberi. And then we have Wernicke-Korsakoff syndrome. It is usually seen in alcoholics, those who suffer from alcoholism. In them, because of too much consumption of alcohol, it interferes with the vitamin B absorption. Okay. Vitamin D you do not get from rice. Okay, there is no component of vitamin D is exclusively from animal sources, not from plant sources. Okay, but vitamin B is washed off. It's washed up in more than enough quantity. It is washed up when you wash the rice, when you throw away that rice water after cooking it. Okay, so yeah, Wernicke-Korsakoff syndrome is common in alcoholics. Because of alcohol consumption, the gut will not absorb vitamin B. So when the alcoholics are admitted to this rehabilitation centers, de-addiction centers and all, along with the treatment, vitamin B supplement is given to them, okay, to correct that deficiency. So in infantile beriberi, there you see tachycardia. Tachycardia means increased heartbeat. Okay, the pulse heartbeat will be more than 120, more than 100 beats per minute. Vomiting, convulsions. Okay, in adult beriberi or wet beriberi, there will be dry skin, irritability, progressive paralysis. Okay, that is because the nervous system is included here. It is affected. Nervous system is affected. Paresthesia, paralysis, hemiplegia. Okay, such things may happen. So this is the different types of beriberi: dry beriberi and wet beriberi. In wet beriberi, there is too much of water in the body. The body feels edematous. Okay, the cardiac output will be too high, because see, when the body has a lot of fluid in it, there is a lot of stress on the heart to pump more blood into the system. Okay, so the cardiac output will be too high, and the heart will undergo various strains, and it leads to heart failure. Okay, then heart hypertrophy, especially in the right ventricle. Okay, tachycardia or bradycardia, either too much of heartbeat or too little of heartbeat. Dyspnea, respiratory distress, because when there is too much of fluid in the body, lungs are also affected. Okay, when there is too much of fluid around the lung, obviously you will feel breathing issues. Edema in the lower extremities. Okay, oliguria, too less urine. Okay, too less urine output. Lactic acidosis, too much of lactic acid in within the bloodstream, within the plasma. Then we have the dry beriberi, peripheral neuropathy. For example, the hands and the legs. Okay, you will have no sensation there. Muscle weakness, gait ataxia. You can't like you are not able to balance yourself when you walk. The person is not able to balance themselves. And paresthesias, they lose the senses, and there is a tingling sensation at the end of their fingers, toes. Then Wernicke's encephalopathy, that is their brain, there will be accumulation of fluid. Okay, then we have infantile beriberi. It occurs in infants, usually by the age of 3 to 4 weeks, who are breastfed by thiamine deficient mothers. When the mothers are deficient in vitamin B, the infants will also be deficient when they are fed with that particular breast milk. Heart failure in these children may occur, it may occur suddenly. Aphonia, they are their muscles are not that firm, as well as when you say phonia, okay, it's about their shrieking voice. Okay, and absent deep content reflexes. There are certain reflexes are seen only in an infant, in a newborn. As they grow up, they grow out of these newborn reflexes. Okay, and when certain parts of their body, like their foot, okay, when they are tapped, or when you stroke their feet, their feet should curl outwards in a specific direction. Okay, so these are all reflexes. So the child's reflex will not be normal. So in your textbook also, you will come across these three different types of beriberi: infantile, wet, and dry beriberi. Just understand the meaning of it. Okay, that's it. That's more than enough. No need to buy heart anything. Just you should know the difference between all these types of beriberi. So, great sources of vitamin B1, thiamine, all your cereals, pulses, okay, unpolished ones. Oil seeds, like, can you give me examples of oil seeds? Mostly when I ask you what is the good source of any vitamin, you are the first one to jump on this particular seed. Most of you will jump on this particular seed. Groundnut, peanuts, etc. They come under the nut section. It's oil seeds. Oil seeds. Yes, flax seeds, sunflower seed, pumpkin seeds, sesame seeds. Okay, so these are the seeds. Okay, they are the good source of B12. Groundnut is a form of nut. It's not a seed. Okay, groundnut, peanuts, etc. Then yeast, meat, fish, egg, milk. Most of the non-vegetarian sources, it will be good in B complex vitamins, especially organ meats and all, liver and all. Okay. For adults, the RDA is for adults, it is important to remember. For other for women, children, it table is given. Okay, but still you should have the knowledge of it. It should not be like that. You should be completely blank when a question about RDA pops up. So adults, 1.2 to 1.5 mg per day. Okay. Coming to the next vitamin B12, riboflavin. So it was discovered in the year 1917. Okay, before the 1920s, riboflavin was discovered. And also see, there are few more recently we have come across some new generation of thought to be vitamin B complex vitamins, but as of now it is not generally accepted under the B complex group, but still they behave in a way it is very equal to how vitamin B complex would behave, like vitamin F and all. It has come up, vitamin F and some when we will discuss about the vitamin like substances. Okay, we'll discuss in detail about that vitamins. They mimic the way how vitamin B complex acts. Okay, so nowadays the innovations and the people who have discovered this form of substances, they want it to be included under the B complex category, but still we are undergoing such certain debates over that. So far they have not been included under the B complex umbrella, but yeah, it could be in the near future. You may have few more vitamin B complexes added into the category. Okay. So the function of riboflavin, vitamin B2, it helps in the metabolism, again, same like thiamine, metabolism of carbohydrates. Thiamine was only for carbohydrates, but here riboflavin is for carbohydrates, protein as well as fat. Okay, growth and repair, development of body tissues, healthy skin, eyes, tongue. Uh, when we will see about the deficiency of riboflavin, you will see the issues. Okay, which will come up. Most commonly, you will see the signs and symptoms in kids. Keep an eye out for these signs and symptoms. Okay, so principal growth promoting factor in vitamin B complex, it helps in growth hormone production. Deficiency, loss of appetite, swollen tongue, cracked lips, eye infection, dermatitis, cracked lips, along with that angular stomatitis. Angular stomatitis is one at the angles of your at the corners of your mouth. Okay, the corners of the mouth, you will see ulcers, flaky skin, dry skin. Okay, some pimple like substances, but it is not exactly acne or pimple. Okay, but it reacts in the same way. So these are the signs and symptoms that you may be deficient in vitamin B2, riboflavin, or even other, not just riboflavin, even in case of niacin, thiamine, and all. The same kind of signs and symptoms could manifest. Okay, so these are the signs and symptoms of vitamin B2 deficiency. Glossitis. Glossitis is the inflammation of the tongue. Chiliosis, that is the dry flaky lips, and you can see the corners of the mouth. Okay, how like the appearance of the ulcer is on spot. Okay, itching and burning eyes, not to be confused with allergic conjunctivitis or the regular infectious conjunctivitis. Because see, when you have an allergic reaction, in certain allergic reaction also, you have this allergic conjunctivitis, your eyes, corner of your eyes and all, it will burn and itch. But along with that, you will have this throat itchiness, you will have running nose and all. So that's a classical sign that you are undergoing an allergic reaction. But when there is an absence of running nose, sinusitis, itching throat, itching ears, okay, and you're just manifested with this particular itching and burning eyes and no other symptoms, and you are known to have no allergy sort of. Okay, so that could be a sign that it is a deficiency of vitamin B, B2, riboflavin. Then sources of riboflavin, again, yeast, whole grain, dry beans, pea, green vegetables. RDA for adults, see, everywhere I have just mentioned for adults. So based on the adults requirement, obviously for children it will be much less. Pregnant women it will be little bit higher. So if you know the daily RDA for adults, okay, doesn't matter man or woman, just if you do the RDA for adults, it's easier to think about a diet plan for other age groups. That's it. Okay. Next, niacin, that is vitamin B3. So it helps our bodies to convert nutrients into energy. The same thing, see, thiamine also was helping your body to convert carbohydrates into energy through Krebs cycle. Riboflavin helped in the metabolism of carbohydrates, proteins, fats. Here again, they have not specified which nutrient, but usually it should be around carbohydrates and all, to convert nutrients into energy. Help your body to make fats as well as cholesterol. Help to repair and form your genetic material in the formation of ribonucleic acid, okay, and deoxyribonucleic acid, the helical structure, okay, to form the helical structure as well as the single structure, single strands of DNA. Niacin is important. So when you suffer from a deficiency of B3 or niacin, fatigue, depression, memory disorders, your risk of getting dementia sooner, okay, loss of appetite. See, loss of appetite is repetitive. In most of the vitamin B complex deficiency, you are seeing this fatigue, loss of appetite, and some neurological disorder is associated. Diarrhea, pellagra disease, dermatitis. Dermatitis is very common. Okay, when you have um, so most of the women, they confuse their acne pimple with vitamin B deficiency. They think that they are suffering from acne and pimples, but usually, if they correct their vitamin B deficiency, that could lead to glowing skin. Okay, so that this is something very confusing. Usually, like dry skin are, it's not just oily skin, but dry skin are also equally prone to sunburns and acne and pimples. Okay, because dry skin, your skin barrier, natural skin barrier, is underperforming, it is completely destroyed. Okay, when you have dry skin, your skin barrier is not that good. If you correct your skin barrier, automatically it will not completely solve the acne and pimples, because it is internal factors will also play out, but the external factors could help you out to tone down the scars, to tone down the aggravated pimples, etc. Okay, so dermatitis, underperformance in the sense of for physical activity. You get tired soon. There is the element of fatigue in your body. Obviously, you will underperform. Okay. So pellagra. Okay, this is the disease due to vitamin B3 deficiency. For example, in B complex, remember which disease, which condition is associated with which form of B complex. Okay, if a question comes about pellagra, you should know it is niacin deficiency or vitamin B3 deficiency. If a question comes like what is the deficiency of vitamin B3, okay, we may not mention niacin, but you should know it is pellagra. Okay, like that. So it is associated with one or more than one symptoms like dermatitis, diarrhea, dementia. Dermatitis, you can see here, the dry skin. And this is a classical example of another castle's necklace. Usually it is seen in prisoners, okay, in the prison food, which is highly deficient in various nutrients, okay. But most of the prisoners, especially where the prison health is not at all, and not at all their focus point. Prison health or nutrition for the prisoners are not at all their focus point. In such cases, Casel's necklace is a common sign. So it's a significant symptom that diagnoses that the person is suffering from pellagra. Okay, it's a classic sign of pellagra. No other in no other disease condition you will get this particular classical sign of a darkened and dry, flaky, scarred, dry skin around the neck. Then we have drug induced pellagra. When you are on specific drugs for a very long time, these drugs could inhibit your guts absorption rate of vitamin D3. Okay, so your tuberculosis drugs, only isoniazid and pyridoxine. Okay, rifampicin and ethambutol, it's fine. Isoniazid and pyridoxine, that they are predisposing drugs. Anti-epileptics, hydronotoins, ethanonamide, diazepam. Okay, And then chemotherapy and immunosuppressive drugs for cancer therapy and all, these are the drugs notoriously known for inducing pellagra. Okay, the food may be like the food sources have enough source of vitamin B3, but if the person is suffering from these specific disorders and they're getting the treatment for that, additional vitamin B supplements would be required, or at least intramuscular injections of vitamin B would be required. Sources of niacin: broccoli, peanuts, chicken, mushroom, bell peppers, capsicums, kidney beans. Okay, good. These are the good. Other sources are also mentioned in the textbook. You can go through it. Gingerly seeds, tuna fish, almond, oyster, brown rice, red rice. Okay, parboiled rice, not the white polished rice. Brown rice or parboiled rice, they are good source of niacin. Barley, corn, your corn, kamakka. Okay, whole wheat, brown lentils, jowar. Okay, so next, coming to folate or folic acid. Folic acid and folate, they have a difference. Folic acid is just the chemical component. When folic acid is mixed with certain other components, it forms folate. Okay, so folate, it helps your cells to grow and multiply. It helps to form your red blood cells. Okay, so this is the reason why you get folate tablets along with iron tablets. Okay, the first and the foremost way of prevention is via diet. Okay, if via diet your body is not responding, then go for supplements, vitamin supplements. Okay, but if your body is not responding to vitamin supplements as well, before because of any malformation in the gut, or the mucus level or the pH level of the gut is not enough for the absorption of vitamin B12, in that case you have to go for weekly injection. This intradermal, sorry, not intradermal, intramuscular injections of vitamin B12 is given once a week. Okay, so that's the last option. Helps to form our genetic material of DNA, RNA. It keeps our brain healthy again, neurological health, supports the brain and brain development. That is the neural tube. Okay, when a woman has conceived, in the first 3 months, that's the first trimester, when the fetus is being formed in her womb, it's the focus of that particular growth is closure of the neural tube. Okay, the neural tube is what forms itself into brain and the spinal cord. Okay, neural tube, first the neural tube will be formed in the fetus, and later on when the fetus develops much more in the 4th month, 5th month, 6th month, and so on, that's when the brain develops, and from the neural tube brain will be formed, and then the spinal cord will form. Okay, so when a woman is suffering from vitamin B12 deficiency, there will be malformed neural tube that will lead to anencephaly, spina bifida. Okay, such issues it's in the newborn. Okay, so rectifying vitamin B12 deficiency, not just B12, vitamin B deficiency as a whole in pregnant women is very essential, so that she has a safe pregnancy, she has a healthy baby. Okay, balances the levels of homocysteine in the blood. Homocysteine is a kind of protein. Okay, it maintains the pH level, it maintains a buffer system within the blood. So, deficiency of folate: sensation of weakness, numbness, and paresthesia. Okay, numbness and tingling of fingers, that is paresthesia, and toes. Ulcers in the mouth, very common. Okay, most of you guys must have suffered from this angular stomatitis, mouth ulcers. And as soon as you see mouth ulcers, without even waiting for the prescription from a physician, all of you will just go to the medical store, get some biotin tablets. Okay, so this is very commonly seen in the Indian population. As soon as they get a mouth ulcer, the first thing they will go out, get the biotin tablets and start on it. But remember, biotin tablets may not help you out completely. when it comes to vitamin B deficiency. If you're suffering from biotin deficiency, obviously it could help. But if it is niacin, thiamine, or any other form of deficiency, you have to get a blood work done. Exactly find out which kind of vitamin B complex are you deficient in, and then get a vitamin supplement exclusively for that. Okay. Sore tongue, feeling of weakness. So folic acid deficiency during pregnancy, this is what spina bifida looks like after a child is born. So the neural tube in the fetus, in the second and the third month, within the first trimester itself, neural tube should be formed. Okay, then the later other organs will be formed. Heart and the neural tube should be formed within the 3 months. So children who are born with this spinal cord deformity, okay, a part of the spinal cord will be coming protruding out of the child's vertebral column. That's what we call as spina bifida. Okay, most of the children who are born with such condition, they lose their neuromotor functions in their lower extremities. Okay, they may have lifelong urinary incontinence, they may have fecal incontinence as well. Okay, and anencephaly, children who are born without the skull, okay, the upper part of the skull. And then cleft lip, cleft palate, again another disorder associated with improper closure of your neural tube. Am I audible? Am I audible? Okay. So cleft lip and cleft palate is also another form of improper closure of neural tube. Okay. So these are the risk factors associated with vitamin B deficiency when a woman is pregnant. So rectifying that is very important. This is one of the reasons why, along with iron tablets, folate tablets, okay, folic acid tablets are also provided. Okay. Then good sources of folic acid, various types of fish like panjaram, okay, paplates, okay, what we commonly called as paplet in northern Maharashtra and all. Then we have tuna fish, all the dark green leafy vegetables, drumstick leaves, gogu leaves, fenugreek leaves. And if you go to page number 376, page number 376, table 19.2, okay, all the major sources of folic acid is given. The first two are that fish I have shown just now, the hilsa fish and the pomfret fish. Hilsa fish is commonly used in Bengali cuisines, okay, and pomfret or paplet, okay, that's used in Maharashtra, commonly Maharashtra, Gujarat, and all. I'm not sure in other states they use it or not. I'm not sure, but hilsa is a very authentic Bengali cuisine dish. It is used. It's a very important part of the Bengali culture. And then so pamphlet and all Maharashtra, Gujarat, it's commonly used. Fenugreek leaves, even not for folic acid, but for other like thiamine, niacin, and all. Drumstick leaves. Okay, drumstick leaves are a very good source. Soybean, brown soybean, organ liver or liver meat, not just for goat, sheep, even chicken, mutton, whichever animal liver meat you could find, that is a very good source. Beetroot, amaranth leaves. Amaranth leaves, the sourcing is not that much, it is very less. Even in egg, you have folic acid, but the amount is very less. Okay, the microgram per 100 gram of egg is very less. Then vitamin B12. It is necessary for the red blood cell formation, nervous system function, prevention of certain forms of anemia, neurological disturbances. As I mentioned earlier, a lot of vitamin B12 is associated with your neurological health. Okay, neuromotor function, neurological health. Functions primarily as a coenzyme in intermediary metabolism of carb, proteins, and fats. It functions as a coenzyme. It helps in the metabolism of these macronutrients. Deficiency would lead to pernicious anemia and nerve degeneration. So it is commonly seen in vegans, okay? Vegans who do not have even, they do not even indulge in dairy products, okay? Pernicious anemia is very commonly seen in vegans. So it's ideal if they can at least depend on vitamin B12 supplements. That could be a very good health benefit for them. Because vitamin B12, you do not have any vegetarian sources as such. It's usually from the animal sources or the dairy products. So vegetarians can at least depend on their dairy products, but for others like vegans, fruitarians, etc., for them they have to indulge into some supplements for this. And the name for vitamin B12 is cyanocobalamin. So this is megaloblastic anemia, normal blood cells, megaloblastic from the name itself. The size of the red blood cell is big. But can you name one more drawback in this particular picture? Obviously, the size you can see, it is much big. But according to function, what do you think? Anyone? If you have an idea of medical terminology, megaloblastic anemia. Yes, it is immature. It is immature. RBC, but big in size. This is pernicious anemia. Okay. Yeah, the lifespan also for the this particular RBC will be very less. Usually, a normal RBC can live up to 120 days. It is much more less for a megaloblastic RBC cell. Okay, so this is one of the causes of pernicious anemia. So the absorption matters. Okay, when the food absorption, in which part of the stomach aids in the absorption of iron as well as of vitamin B12, that is important. Okay, so the fundus of the stomach, okay, when the parietal cells are destroyed, fundus of the stomach, this is the upper part of the stomach. Okay, it has parietal cells. When these cells are destroyed, can you give any reasons why these cells could be destroyed? In which cases you may lose the function of these parietal cells? Yeah, people who suffer from acidity, acid reflux, as well as something else which could actually destroy the lining of the stomach, a disease condition. Something that is, yeah, gastric ulcers, peptic ulcers, inflammation of the GI tract because of stress, or you're indulging in too much of caffeine, too much of spicy hot food. Okay, most commonly it is the ulcers, peptic ulcers, okay, that will destroy the parietal cells. So in that case, your iron will not have a good acidic environment, okay, like you as we have studied earlier, iron requires a good HCl environment, acidic environment. So when the parietal cells are destroyed, the stomach can't produce enough hydrochloric acid for the iron to be absorbed, okay. If and along with that, B12 will also not be absorbed, so there will be deficiency, iron deficiency anemia, along with that pernicious anemia, okay, because of B12 deficiency. So you require this parietal cells, they produce acid which helps in ion absorption, and the parietal cells also produce intrinsic factors, okay. Intrinsic factors are like there are various blood clotting factors, intrinsic and extrinsic factors available within the body, and even through your food sources you will get these factors for various functions in the body. So intrinsic, it will secrete not just acid like HCl, but also intrinsic factors for B12 absorption. When the parietal cells are destroyed, neither the acid is produced nor the intrinsic factors are produced. So you will get just with the destruction of parietal cells, both iron deficiency anemia as well as vitamin B12 deficiency anemia, that is pernicious anemia. Okay, both will be manifested in the patient. So the signs and symptoms: weakness, bleeding of gums, jaundice, loss of appetite. You can see here the difference between the color, okay, a healthy skin and how the pale skin looks like. Glossitis, inflammation, inflamed tongue. Yeah, parietal cells are in the lining of the stomach. RDA of vitamin B12, you don't require more than 2.5 microgram per day. So all the good sources of vitamin B12 food, all your dairy products, okay, meat products, fish, egg, red meat, okay, sardines, prawns, chicken, okay, oysters. Next, vitamin B6, pyridoxine. It helps in protein metabolism, not carbohydrates, not fats. It helps in protein metabolism. It's involved in the formation of hemoglobin, hormones, and structural proteins. Okay, anything that is involved in protein metabolism will also always be involved in the formation of proteins. You break down proteins to form more proteins. So remember that. So anything that is involved in the breakdown of protein will also help aid in the formation of proteins, more proteins. Okay, healthy development of nervous system, again nervous system is involved. Deficiency, tiredness, fatigue, these are signs and symptoms, okay. Tiredness, fatigue, irritability, premenstrual tension or PMS. Infants may suffer from convulsions if there is a deficiency during the pregnancy and post birth breast lactating time. Then symptoms, again sore glossy tongue, cracked and sore lips, skin rashes or dry flaky skin. People, when they get the skin rashes and all, they go for this acne treatment, pimple treatment, but it will not be majority, it's not an infective causes that led to skin rashes, like in most of the acne conditions or some dermatitis acne conditions and all. uh, a huge emphasis is based on the bacteria present on the skin, okay. But here it's not something bacterial which led to the skin rashes, it was the vitamin B6 deficiency, okay. Somebody wanted the previous slide. So these are the most common symptoms. But again, just by looking at the symptoms, you can't say this is vitamin B6 deficiency, because as we have discussed so far, most of the B complex deficiencies have similar kind of signs and symptoms. So it is always, we can only trust the blood work, nothing else. Okay. So here we have sideroblastic anemia. Okay. Again, just can you try to see, all it's already given, the meaning of the terminology is given. So sidero, it means iron, okay. Sometimes ferrous, here they have used sidero. Plastic, again immature. Anemia, decreased amount of red blood cells. Okay, so what is happening here? A single RBC has a specific capacity of carrying iron molecules. Okay, a single RBC has a specific, it is around 3 microgram or something like that. Okay, one RBC can take up to only 3 microgram, something like that. Hemoglobin can take up only up to 3 microgram iron molecules. So in sideroblastic, what is happening? It tries to compensate for anemia. Each RBC, it will try to grab onto as much as iron possible, okay, more than its capacity. On top of it, it is an immature RBC, dysfunctional, not capable to carry iron molecules throughout the bloodstream. So this leads to sideroblastic anemia. Okay, there is too much of iron component in the RBC. Along with that, the RBC is not mature enough to supply oxygen. Okay. So sources of the vitamin B6, it is surma fish or vanjaram, or something we call it in Malayalam and chura fish. Okay, the one which you can see here in the this particular, the dark shiny one, the most shiny one, that's a vanjaram or surma fish. And other forms of fish, the hilsa, pomfret, and then we have this Bombay duck. Okay, I don't know what you call in, I forgot what we used to call it in Gujarati or Marathi. Can anyone just remind me that what is the name of this? Okay, Bombay fish. Okay, in English, I guess it is called Bombay duck or something like that. Yeah, Bombay fish. Yeah. Okay, so somebody asked for the vegetarian sources. Go on page number 393. 393, table 20.2. Again, drumstick leaves. It's coming popping up again and again for various sources of vitamin B complex. Drumstick leaves, walnut, pistachio, sunflower seeds, gingerly seeds is also popping up here and there. In most of the sources table, you will see sunflower, gingerly, drumstick. All the non-vegetarian sources are similar everywhere. Okay, nuts and seeds. Okay, page number 393, go for the vegetarian sources. It's also vegan, they have not given any dairy products, so vegetarian vegan sources are also mentioned on page number 393, table 20.2. Next, pantothenic acid, vitamin B5, helps to produce antibodies, helps to produce production of cortisol for immunity, and then energy from production of energy, again metabolism of carbohydrates, proteins, fats to give energy. Formation of acetylcholine and epinephrine. Where do you use acetylcholine? Anyone from the science background? Where do you use acetylcholine? What is the use of acetylcholine? Many times we have come across this acetylcholine words again and again. Yes, acetylcholine helps in transmitting your nerve signals, okay, throughout the, from the brain, from the central nervous system to the peripheral nervous system. Okay, acetylcholine is important for your brain to send out nerve signals. Okay, epinephrine. Anyone has heard about epinephrine anywhere? Epinephrine used in sports also. Another name for epinephrine is adrenaline. Where have you heard about this earlier? Adrenaline, epinephrine. Yes, it's a hormone. It's a hormone. What does it do? It's a fight and flight hormone. When you are under stress, okay, when you are under stress, when you are panicking, when you're in a panic mode, your body adrenal glands which are on top of your kidney, okay, they secrete epinephrine, also called as adrenaline. Okay, so either you can face the situation or you can run from the situation. Okay, it has more function to that. Epinephrine is also used as an illegal drug for performance enhancement activities in sports and all. In sports nutrition, we will discuss about that. Today we have discussed only half of the chapter. Tomorrow or next week we'll discuss complete the chapter. Okay, testosterone booster. Okay, for doping and all. Yes, for sports doping and all. So symptoms of vitamin B5 deficiency, paresthesia, again, that tingling sensation, numbness, pricking sensation at the end of your fingers, toes. It can happen anywhere, but it starts with your it's something goes wrong in your peripheral nervous system. This is the first symptom which you get. Okay, even when somebody is going to get Parkinson's disease, okay, Parkinson's, paresthesia is a very common trait. First, it starts with paresthesia, then there is a pin rolling kind of symptom, etc., and then it aggravates into Parkinson's. Okay, joint and muscle aches, fading of hair color, anemia, reduced immunity, impaired antibody response, headache, depression, insomnia, fatigue. So yeast has come up 3 or 4 times throughout this particular lesson. Sunflower seeds again and again. Shiitake mushrooms, rice bran. Rice bran means along with the husk, okay, or just the husk of the rice. It is used in various cereals, okay, rice bran cereals and also it is available. Egg yolk. These are the good sources of pantothenic acid. RDF IMG per day for adults. Next, we have biotin. Again, it helps the body to metabolize protein, fats, carbohydrates. Same functions are coming up again and again for almost all the vitamin B complex. It helps the body to process glucose. It means that it will come in the Krebs cycle or in the glucogenesis cycle. It also contributes towards healthy nails, hair, and skin. Deficiency of biotin will obviously lead to some patchiness, pimples in the skin, hair loss, etc. But we can't always attribute, like we can't say it like with a guarantee that if you take biotin tablets, your hair health, nail or skin health will improve. There are various factors playing with the health of these body parts. Okay. It is ever found in various cosmetic as well as health products for skin and hair. So biotin deficiency, you will have brittle nails, conjunctivitis, depression, dermatitis, fatigue, hair loss, hallucination. These hallucinations and all these are the extreme cases of biotin deficiency, for like months and months of biotin deficiency. Loss of appetite, muscle pain, nausea, neurological symptom, weakness. You can see the child's face of a child who was born with biotin deficiency, and just check the page number 397. If those who have the textbook, go to page number 397. Can you see within 15 days of biotin treatment, when you compare these two figures, figure A and B on page number 397, it's the same face, the same photograph of this particular baby. Within 15 days of treatment with biotin, what kind of change the child has seen. Okay, so this is one of the reasons why people use a lot of biotin in the cosmetic industry to give that instant relief from inflammatory pimples and all. So this is the assignment I had given to previous batch students as well. The present admission, the recent admissions can also do the same assignment. Just make a table in a single page. Okay, if you want to do it in Excel, that's fine. If you want to do it in a single page, in a single book, take a page. make a table of all the B complex vitamins we have discussed. I